So let's just update you on that breaking news we brought you a short time ago. We were reporting that the King had arrived at a hospital in London this morning, and we've just had a statement put out by Buckingham Palace. They have said in the statement, the King was this morning admitted to a London hospital for scheduled treatment. These are the pictures of him leaving Clarence House earlier on today. His Majesty would like to thank all those who have sent their good wishes over the past week and is delighted to learn that his diagnosis is having a positive impact on public health awareness. Buckingham Palace, they're confirming that the King has been admitted to a London hospital for his scheduled treatment. And as we were saying earlier on, the King had approved a statement which was very clear about the treatment that he was going to undergo. They talked about him needing treatment on an enlarged prostate and unusually upfront about that kind of medical information which royals wouldn't normally necessarily disclose. Let's bring in our royal correspondent, Laura Bundog. So, Laura, we were talking about this earlier. We knew that the King had arrived at a hospital. Buckingham Palace now confirming that he's been admitted for this scheduled treatment.
That's right. We saw the King accompanied by the Queen as well, leaving Clarence House, their London residence, within the last hour or so. They made their way to the London Clinic. You'll know that name because that is the private hospital where the Princess of Wales is currently an inpatient after she had the planned abdominal surgery we found out about. The King arriving there for what we understand will be this corrective procedure. He has been seeking treatment for an enlarged prostate. He went public with that news last Wednesday, the King himself taking the decision to make public the details of his diagnosis because he was keen to encourage other men to get themselves checked. And in that statement, we've had a short statement from the palace this morning saying that he's delighted to learn that the fact he did give those details about his diagnosis has had this positive impact, as the statement says, on public health awareness. Now, we don't expect we'll be getting any details on how long he will be staying in hospital or indeed what kind of procedure he is having. But we do know that he has now been admitted to the hospital where he will have what was described as a corrective procedure following the diagnosis of an enlarged prostate just before Christmas. We last saw the royal family on Christmas Day there, seen all together at Sandringham House, the King's private country estate in Norfolk, all in good spirits. We haven't actually seen the King out and about since then, nor the Princess of Wales, purely because of their medical diagnoses. It was a shock statement, wasn't it, last Wednesday when we learnt that Kate had had this procedure, this operation, that she would be in hospital for 10 to 14 days and then out of action until probably Easter. And then within a few minutes, really, of that announcement came the news the King would also be undergoing a procedure. We saw Camilla, the Queen, out and about, though. She was asked about the condition of the King last week, and she said that he was fine and looking forward to getting back to work. We don't know when he will be back to work. All we know is that he is now in hospital where he will undergo that procedure for an enlarged prostate.
And yes, Laura, it's really interesting, isn't it, that statement where they've made a point of not just confirming that he's gone in to have this treatment, but also that he's delighted to learn that his diagnosis is having a positive impact on public health awareness. Just how unusual was it to get that forewarning of hospital treatment from such a senior member of the royal family?
It's really unheard of. It's really unusual. I think it's unprecedented to have not just one but two sort of big medical announcements coming from the royal family. You could ask why they might have done this. Maybe this is perhaps the royal family wanting to be perhaps more open with the things that they have to undergo that many other families across the UK also have to undergo themselves. But it was a shock statement and a surprise as well to have such a candid sort of announcement, both from Kensington Palace, which speaks, of course, of the Princess of Wales, and Buckingham Palace.